What really happens to your vagina when you stop having sex? Does it lose its elasticity? Does it shrink? Will your libido take a hit? Can it affect your overall health? And what about arousal? Will it affect your ability to be turned on altogether? Or if you ever wonder about the effects of sexual activity on your overall body health, what will happen? Well, if you're thinking about those things, you're in the right place. Let's break it down together in this video. Stay tuned. I'm Dr. Deji Daramola. I'm a Canadian-based family physician. Please hit the subscribe button if you haven't. If you have, thank you very much. Now, the first thing I would like to talk about is the question, will your vaginal wall lose elasticity? Because that's important. Yes, it will lose elasticity, but it's not a permanent thing. It's not permanent. Without regular penetration, the vaginal walls become slightly less elastic due to reduced blood flow and reduced collagen production. However, this is reversible. Engaging in regular sexual activity will bring back the blood flow to more collagen production, and that will help. Even things like self-pleasure or pelvic floor exercises can help maintain elasticity over time. The second thing is, will the vagina become smaller? Yes and no, not exactly. And the reason is because the vagina is incredibly adaptable. It is an organ that is absolutely adaptable. It expands, it contracts based on whatever it needs to do. It just gets the job done. I remember the first time I saw a vagina expand to accommodate the head of a baby during a delivery. I almost passed out because the ability to expand just wowed me. And at the same time, when you do a normal pap smear as a doctor, you can see that the ability to contract also is there. It's just an incredible organ. But if there's a long period of inactivity, the muscles in vagina might feel tighter, but it's not because it's really smaller. It's because there's reduced stretching and reduced lubrication, and this can also be reversed with stimulation and use. Now, what happens to your libido? That is one question I need to move closer to answer. Now, it depends on the individual. So some people experience a dip in the desire due to hormonal activities and the lack of sexual activity, but some others do not experience any difference. So it depends on your physiology and in the mental state in which you are. But whatever the case is, whenever you decide to become sexually active again, these things are reversible. That's the way it is. The vagina is highly adaptable, and a lot of the things that are even negatives become reversible once you make up a mind to be sexually active again. Now, let's talk about whether you will stop getting aroused or not. Well, the answer is that no, you will not stop getting aroused. It's not going to lead to your ability to be aroused. However, it may take longer for you to achieve arousal compared to, if you were regularly active sexually. Over time, you get lower hormonal levels, and reduced sexual activity can make it harder to get turned on quickly. However, arousal is as much a mental activity as it is a physical activity. So reintroducing sexual activity can bring it back to normal, and having your head in the right space can accelerate the process. And the last question I would be addressing is, will it affect your overall health? I can hear some people saying, of course not. And some people are saying, yes, of course. Well, the truth is that it can affect your overall health. And the reason is because sex or sexual stimulation contributes to better circulation. It contributes to stress relief. That's the second one. It improves your mood. Believe it or not, you release dopamine, and that helps your mood a lot. And it even helps contribute to better immune function. If you have a better immune function, then you don't get sick often. So these are important things. Now, when you lack sexual activity or you stop sexual activity, it doesn't mean that you are going to be ill or anything like that. But the lack of sexual activity might lead to increased stress, lower vaginal lubrication. When you have lower vaginal lubrication, sometimes because it's itchiness, sometimes you feel dry down there, it's uncomfortable, and in some cases it may lead to vaginal atrophy. Have you heard of the phrase, if you don't use it, you lose it? Yes, that can happen to the vagina. In some cases, the vagina might atrophy from lack of use, and this happens especially in postmenopausal women, and when they try to have sex, then sex becomes really painful because of the vaginal atrophy. The good news is this is also treatable. But other good news is that none of these effects, like I said earlier on, are permanent. Reintroducing sexual activity or even focusing on overall wellness can counteract most of the things that are side effects that I have spoken about today. So that's all I'm going to talk to you today about, what really happens to your vagina when you stop having sex. Please subscribe to my videos, and I'll see you in the next one. Peace and out.